Ever wondered how a head-to-toe nursing assessment is done? Today we delve into this intricate process. A thorough head-to-toe assessment is a cornerstone of patient care, providing invaluable data about a person's overall health status. In this video, we'll break down this complex procedure into manageable, easy-to-follow steps. From the top of the head to the tips of the toes, we'll guide you through each critical aspect. Ready to understand the crucial steps involved in a head-to-toe nursing assessment? Stick around. First things first, preparation is key in any nursing assessment. Before diving headfirst into the process, it's crucial to gather all the necessary tools. This includes your trusty stethoscope, a pair of clean gloves, and a handy pen light. These items will aid you in the thorough examination of your patient's health status. But remember, tools alone won't make the cut. Establishing a comfortable environment for your patient is equally important. Imagine trying to conduct an assessment amidst a whirlwind of distractions. It's hardly ideal, right? That's why you should aim for a quiet, private space. This not only facilitates an efficient assessment, but also respects the patient's privacy and comfort. Think of it like setting the stage before a play. The right props, the right setting, and a well-prepared cast. That's you can make all the difference. With all the necessary tools at hand and a conducive environment, we can now commence the assessment. The assessment begins at the top, with the head. This is our starting point as it allows us to make an initial observation. We're looking at the patient's face, checking for symmetry. This is crucial because any asymmetry or distortion could be an indicator of a neurological condition. Next, we inspect the scalp. We're not just looking for lice or dandruff here, but also for any bumps, lesions, or other abnormalities. Then, it's onto the eyes and ears. These are key sensory organs and we need to ensure they're functioning well. We're looking for clear, bright eyes with equal pupils and responsive to light. Ears should be symmetrical and free from any discharge. Throughout this process, it's important to note any unusual findings. They could be early signs of health issues that need to be addressed. A thorough head assessment sets the pace for the rest of the procedure. It's where we set a baseline from which we can compare the rest of our findings. Next, we shift our attention to the chest and abdomen. The chest and abdomen are pivotal areas for our assessment, housing vital organs such as the heart, lungs, and digestive system. It's important to remember that these regions can reveal a lot about a person's general health. Now, we commence with auscultation, which is the act of listening to the body's sounds. Using a stethoscope, we'll start with the heart. Listen for the rhythm and rate, which should be regular and between 60 to 100 beats per minute for an adult at rest. Pay close attention to the sound of the heartbeat. It should be clear and strong, without any unusual sounds or murmurs. Next, we move on to the lungs. Again, using our trusty stethoscope, we listen for the breath sounds. Healthy lungs should produce a clear and consistent sound without any wheezing or crackling. These sounds should be heard in all lung fields, front, sides, and back. Once we're done with auscultation, we move on to palpating or feeling the abdomen. This part of the assessment can reveal a lot about the health of the digestive system. Start by asking your patient to relax their abdomen. Use the pads of your fingers and move in a circular motion, starting from the right lower quadrant and moving clockwise. What are we looking for? Well, the abdomen should be soft and non-tender. Any hardness, lumps, or tenderness could indicate an underlying issue. In addition, observe for any visible pulsations or unusual movements. This step is crucial. The information we gather can be critical in detecting potential health issues early. It's not just about identifying problems, but also about prevention and early treatment. The chest and abdomen, like every other part of our assessment, require diligent attention to detail. And although it might seem a bit daunting at first, with practice it becomes second nature. Remember, meticulousness in this step can help detect critical issues early. We now move further down to the lower body. Starting with the hips, it's crucial to observe their symmetry. Look for any signs of deformities, swelling, or discomfort. Gentle palpation can help you identify any tenderness, warmth, or abnormal lumps. A healthy hip should feel stable and free of any pain when moved. Next, let's focus on the legs. Start by inspecting the skin for any abnormalities such as wounds, rashes, or discoloration. Palpate the muscles and joints for tenderness, swelling, or warmth. Pay particular attention to the knees, as they are often susceptible to injuries and diseases. Remember to check both the front and back of the legs to ensure a thorough examination. Moving on to the feet, check for swelling, blisters, or wounds. The color of the feet can indicate circulation issues, so look out for any abnormal paleness or blueness. Don't forget to inspect the soles and between the toes where problems often go unnoticed. It's also important to assess the patient's mobility and strength. Ask the patient to perform simple movements like lifting the leg, bending the knee, or wiggling the toes. These actions can help you evaluate muscle strength and joint flexibility. In addition to physical examination, ask the patient about any pain, stiffness, or difficulty in moving. This information is valuable in assessing the overall health of the lower body and can guide further diagnostic tests or treatments. Remember, the purpose of a head-to-toe assessment is not just to identify issues, but also to create a baseline of the patient's overall health. This allows healthcare professionals to track changes over time, making it easier to identify improvements or deteriorations in the patient's condition. So, take your time, be thorough, and remember that patient comfort is paramount. Your gentle touch and reassuring demeanor can make the assessment less stressful for the patient, ensuring a more accurate and beneficial examination. A comprehensive lower body assessment completes the physical examination. With the physical examination done, we're not quite finished yet. You see, the completion of a physical examination is just one part of the overall nursing assessment. It's now equally important to evaluate our patient's mental state, their comfort level, and their understanding of their health. We know that our patient's mental state can greatly influence their physical well-being. So take the time to look for signs of anxiety, depression, or confusion. By doing so, we're not merely treating a body, but a whole person. Next, let's consider comfort. Is our patient in pain? Are they comfortable in their environment? These are crucial factors that can impact recovery and overall health outcomes. Assessing comfort goes beyond asking, "Are you comfortable?" It's about observing nonverbal cues and understanding the individual's unique needs. Moreover, it's vital to gauge our patient's comprehension of their health status. Misunderstandings can lead to non-compliance with treatment plans, so clear, empathetic communication is key. And let's not forget about documentation. It's not just a formality, it's a critical step in ensuring continuity of care. By accurately recording our findings, we enable other healthcare professionals to understand the patient's condition and progress. Finally, we must communicate our findings with the patient and the healthcare team. This fosters a collaborative approach to patient care, ensuring everyone is on the same page. And that concludes a head-to-toe nursing assessment. Remember, practice and patience are key to perfecting this essential nursing skill.